So at the outset, these are the major heads that we have to do. Background, definitions, indications, selection of agents, what is a technique, surgical hand scrub, and others. Why all this fuss? Infection in the healthcare setting, main cause is basically through the hands of the relationship between hand hygiene of healthcare personnel, doctor, patient, etc. Somerville's had the historical study where you can see that the mortality rate significantly dropped in 1 year after hand washing started up. So we have to look at different settings. OPD, what is the standard that we require? In the operation room, what is the standard that is required? In the wards, what is the standard which is required? So there are resident flora as well as transient flora as well as infectious flora in the hands. So these are some of the resident flora. You all know that Staphylococcus epidermidis is the common thing. It does not multiply on the skin, but it rather dries off and easily mechanically removable by soap and water. And pathogenic importance depends on the species as well as the virulence. So we are a germ farm. The hand is a germ farm, and the hand which is treated is a hand which kills in the ICU. There are different types of germs, and these are some of the definitions. Hand hygiene is hand washing. Is basically performing hand washing, antiseptic hand wash. All these are basically incorporated into hand hygiene. Washing is with plain soap and water. Antiseptic, if detergents containing an antiseptic agent is used, it's called an antiseptic hand wash. Alcohol, there are about 70% or 60% alcohol-based hand rubs, and they are alcohol-based hand rub. And surgical hand hygiene or antisepsis uses alcohol-based or betadine-based used on a surgical personnel before that. If hands are visibly dirty, you have to use soap and water. Maybe an antiseptic or an antimicrobial soap and water. If hands are not visibly soiled, then you can use an alcohol-based hand rub. This is what the CDC has indicated. This is the schematic representation of what happens when a transient flora with washing. You can see that these flora these are the follicles, and this is basically the area of bacterial colonization outside, which significantly reduces with washing. Now if you scrub, it completely goes off for some period of time, but then there will be a recolonization here. Okay, so before as well as after patient contact, we have to do that. In the ophthalmic OPD, you have different areas of patient contact, right from the slit lamp examination, slit lamp procedures, A scan, dressing of a surgical wound. All these are indications before which you have to perform a hand hygiene. How do you basically select a process? Plain soap is good. Better would be an antimicrobial soap. Even better would be an antimicrobial hand rub. And this is a graph which shows that the killing of organisms is maximum with 70% alcohol, and it stays a little longer with that. And we'll go into the videos later. Alcohol-based hand rubs are slightly better for the skin, and if you look at time, 56 minutes it took for a nurse if they washed about 8 times per hour, 7 times per hour or 8 times per hour, whereas with alcohol it took 18 minutes. So we are saving about 45 minutes if you are using an alcohol scan rub. So for hand rub, as I told you, if it is not visibly soiled, use alcohol. If it is soiled, use a soap and water, and then only do it. So these are some of the common areas which are missed, which will again be shown in the video again. And the technique is that you have to use both palms, then go one over the other, then this knuckles, the tip of the fingernails, and then the wrist. And each finger has to be looked at as though there are about 4 surfaces: the volar surface, the dorsal surface, the lateral surface, and the medial surface. And each of the surface has to be taken care of, and the interdigital areas. That is the most important thing. So decontamination after contact with the mucous membrane, body fluids, excretion, unclean body site to clean body site if you are shifting, after removing gloves, eating toilet, slit lamp, appellation, tension, all these conditions we have to decontaminate. So this is again alcohol hand rub technique, and this is the adherence ratio. We all say that we require this, but what is adherence in hospital? Very pathetic. 20%, 40%, 30%, 48%. So there are a lot of reasons. One guy would say, the cardiac surgeon would say, no, I am big, I don't need to wash my hands. So if that is the problem, then a lot of people can get infection. too busy, understanding overcrowding, patient needs to take priority. All these are important things. Purpose of surgical hand rub is to remove debris. We have to remove the transient microorganisms on the skin now and reduce the resident microbial count to a minimum, and that should be for about 2 hours. So again, we have numbered stroke method or timed scrub method. Timed scrub, if it is, we use about 3 to 5 minutes for each scrub, and you use about 2 scrubs. And numbered stroke, each surface is stroked by, let us say, 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then the next surface is done. That is numbered stroke. So you have to remove rings, watches, bracelets, etc. And fingernails must be clean and short. Skin over hands should be intact. If there is a problem, wear a water-resistant bandage and then do it. Okay. So we will come into the surgical scrub technique in the videos. So administrative measures, making improved hand hygiene by placing alcohol-based solutions. If you are owning a hospital, place alcohol-based solutions on each place where the patient and the doctor is encountering, and provide all these pocket-sized containers. Alcohols are flammable, so it has to be very careful about that. And there are certain performance indicators that you can keep in your own place. And alcohol-based hand rubs are lesser time and if more effective, more accessible than sinks, and reduce the bacterial counts. So we are all finishing the presentations very quickly so that we are able to give about 1 hour to the wonderful video session. If you have friends, please call them here. Thank you.